Good morning. Good morning. My name is Mabhala from University of Chester. I'm going to present a new psychoactive substance. This presentation comes from the work that we conducted in Telford and Rankin in Midlands. What we're looking for is the use and the associated health harms of new psychoactive substance, also known as NPS. Before I start to present the findings of our research, I'm just going to quickly go through what we already knew before attempting to do this study. Our paper outlined the challenges facing the policymakers as well as the researchers in regard to NPS. We also know that the NPS popularity is rising amongst the young people. How do we know that? We know because the Flash Eurobarometer survey identified the rise in NPS amongst the age 15 to 24 years, from 5% in 2011 to 8% in 2014. We also know from this UK survey, which found that 33% of the participants of this age group admitted to use ketamine. We also know from the similar results emerged from the study conducted in Scotland in the same group. We knew that there are still issues around the definition of NPS, so we adopted the United Nations Office on Drugs and Crime definition. We knew that the NPS are diverse and constantly changing, and they broadly reflect the chemistry of six classification of illicit substances. Our paper summarized the NPS into 7 classifications according to their pharmacological action. We also outlined the health harms associated with each classification of the NPS, as you can see on that table. Our aim was to increase our understanding of the relationship between age and the prevalence of NPS awareness, the usage, the accessibility, the extent of their health harm in Telford and Rankin Midlands. Our design was cross-sectional study. We analyzed, there we go, it's gone. It is back. We analyzed the data using NPSS statistic package. We analyzed the data with the intention to accept or reject the null hypothesis, which is there is no relationship between age and awareness, the use and accessibility of NPS. A total of 204 participants completed the survey, 84 male, 115 female, 6 undeclared, with a mean age of 25.7, a median of 25, a mode of 18. And our study revealed that 86% knew about NPS, 69 knew someone who uses NPS, 13 knew more than 5 people who use NPS, 40% felt it was easy to access NPS, 10% had used NPS at some point, and 12% had experienced harm associated with NPS. We then used inferential statistics to determine if there was any correlation between age and awareness, the use, accessibility, and harms associated with NPS. Spearman correlation coefficient significant level was set at p-value of less than 0.05%, and a confidence interval of 95%. The experiment showed that there was a positive correlation between age and knowledge of NPS, a positive correlation between age and the number of time they accepted and consumed NPS. There was also a statistic significance between the correlation between age and knowing NPS. A positive correlation between age and knowing someone who used NPS. There was also a positive correlation between age and perception of how easy it was to use to access NPS. There was a negative weak correlation between age and experiencing negative effect of NPS. We therefore concluded that while young people's NPS use remains low, they are more likely to use NPS than the general population. We also felt that despite the young people's high level of awareness of NPS, the fact that they knew so many people who use NPS raises a concern about their exposure. We therefore recommended that the efforts should be put into preventing the uptake of NPS amongst this population group, and we also felt that there should be more effort in restricting the access, and we also felt that there should be more intelligent sharing of the current NPS trends and experiences. And that concludes.
Thank you for your nice presentation, Andy. And now, do you have any questions for him? We have plenty of time for the question. Vincent is not here yet, so please. Yeah? Oh, he's here. Thank you. I'm really sorry. I didn't recognize that you arrived. Okay.
I have two questions, actually.
Okay.
So, how do you think that most of the young people get access to these drugs? And a second part plays with that. So, how do you propose that it be prevented?
This survey was done just before the United Kingdom published a registration which attempts to restrict the access to NPS. So at the time of doing this survey, which was before April, so you could access NPS they were easily sold in head shops, and some of the e-cigarette traders could legitimately sell them. But since April, United Kingdom has made it almost impossible to sell those NPS. So the attempt has been made, but whether that attempt is completely restricting, we still don't know.
Thank you. Any question? Because I have a question to the audience. How familiar you were with the NPS? Did you know what is NPS before he told it to us? Can you raise your hand? How new?
Yeah.
How many of you knew? Because I have to admit that when I read this abstract, I have to go and do some Google research and found out what it really is. So, thank you.
Thank you.
And I guess the trouble there is that they are constantly changing. So that's what makes the legal framework so difficult. That instead of just saying that you cannot sell cannabis and then you have the chemical formula, for these drugs, they're always a step ahead.
Absolutely. As I said in my presentation, they are constantly changing. So, every time you issue a legislation to stop one, they change the chemical composition to
Exactly.
Yeah.
Thank you.
Thank you. Thank you very much.